held RGV Primary Care Annex ribbon cutting ceremony. And to begin today's festivities, I would like to call to the podium Mr. Hector Trejo, who will lead us in the Pledge of Allegiance. He is a UT RGV AHEC scholar, a third-year medical student, and a product of the San Carlos community. Please join me in applause.
Thank you. Okay. Great. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you, Mr. Trejo. Once again, a product of the San Carlos community right here where we're at today. And now for the national anthem. With our invocation this morning, we have Ms. Belinda Reyes, Chief of Staff for External Affairs here at Precinct 4.
Good morning. Please bow your heads. Heavenly Father, within and among us, bless this new workspace and those who work here. Inspire us to make this a place of sincere and devoted effort, vision and determination, appreciation for each other, compassion for others, wisdom in making decisions. Grant to physicians, nurses, and all healthcare professionals wisdom and skill, sympathy and patience. Keep them safe and preserve them from all contagion. Cheer, heal, and sanctify the sick, and send down your blessings on all those who care for them. We also ask for blessings for those that helped in making this facility available to our community. In God's name we pray. Amen.
Thank you, Ms. Reyes. And I would like to introduce some special guests that we have here this morning for our ribbon cutting ceremony. First and foremost, I'd like to introduce Ms. Lydia Maldonado, the Heart of San Carlos. And with us, we have several members of the UT RGV School of Medicine leadership team. We have Dr. Linda Nelson, Dr. Sean Salnine, Dr. John Renaud, Dr. Leonel Vera, and Sofia Hernandez. With us, we also have Hidalgo County Health Department Director, Mr. Eddie Olivares. And at this time, I'd like to introduce Mr. Linnea Olivares with RO Engineering. Giving this morning's opening remarks, we have, and it is my pleasure and honor to introduce Hidalgo County Commissioner for Precinct 4, Eli Torres. Please help me welcome her.
Well, hello and good morning, everyone. Thank you so much for joining us this morning. It gives me great pleasure that we are here today to celebrate the opening of this primary care annex building, which is behind me, that will serve as an extension of healthcare services to the people of the surrounding community of San Carlos. In 2018, Hidalgo County Precinct 4 and the University of Texas, Rio Grande Valley partnered to provide a unique medical clinic in the rural San Carlos area to offer much-needed primary care services at an affordable cost. At the same time, the program also serves to provide UT-RGV students field training in their areas of specialty. Since the grand opening of the UT Health RGV Area Health Education Center, or as we all call it, the AHEC Clinic, the clinic has been extremely successful. As a matter of fact, I remember speaking to Dr. Nelson and Dr. Renau about the grand success of the clinic. Soon after, conversations started about the need for more room in order for us to serve more people. A few months later, we learned about the availability of a portable building that was previously used as a medical lab for the county. We quickly moved to call dibs on it, and we knew exactly where it was needed. We knew that it was the cost-effective answer to provide the additional space needed to service more people in this community. Once the building was designated for the site, the Precinct 4 and UT-RGV collaboration continued for this project with RO Engineering. We want to take this opportunity to thank Mr. Nick Perez with the Precinct 4 team, who spearheaded this project with the UT-RGV staff. Nick, please wave. Thank you, Nick. We would also like to thank RO Engineering for doing such a fantastic job, and the Hidalgo County Facilities and Maintenance Department, who ensured the building was ready for clinic operations. RO Engineering, please wave. Thank you, sir. We would also like to thank and mention that there are more improvements to the area that are forthcoming in the very near future. In a few short weeks, we will be back here for a groundbreaking ceremony to announce the expanded parking and lighting to better accommodate visitors to the AHEC Clinic, the WIC Clinic, which is located in the main building, and the Head Start Center located just south of us. We are excited that many improvements to better serve the community of San Carlos that are slowly and things are coming together for this community. We have made many efforts to help expand access and resources to this area, such as a bus stop for transportation needs, expanded clinical space for primary health care, drainage improvements, and in the very near future, improved parking for all county services. I would now like to pass the microphone to Dr. John Renau, Senior Associate Dean with UT-RGV's Community Health Partnerships Office, who will say a few words on behalf of UT-RGV.
Thank you, Commissioner.
Thank you.
Good morning, everyone. Beautiful, sunny, warm morning. It's nice and warm. Because it's so nice and warm, Mr. Olivares, I'd like to go on just as long as I want to, so I'm going to make some remarks. There's an old saying, one of your show, I guess now, to say real men eat quiche, but they also said real men don't cry. I got to tell you, this event brings tears to my eyes because it's remarkable. It really is a remarkable event. Certainly it's remarkable because of this beautiful facility, right, that the county spent almost $500,000 to move and outfit for us. But it's really not about the buildings, right? It never is about the buildings alone. But it's very impressive, and we thank you for the partnership to make this happen. But even more impressive is the multiple partnerships that allows us to arrive at today's event, certainly with the County of Hidalgo. Precinct 4, Commissioner Eli Torres and her remarkable staff. But it's also remarkable at the community level. Miss Alicia Rodriguez. Really, we wouldn't be having this conversation. She's the director of our Community Education Center at San Carlos, Endowment Center. It wouldn't happen if she hadn't been willing to give up her office in this building 6 years ago, right, when the conversation started. It wouldn't be happening without the partnership and investment of Mrs. Lydia Maldonado. By the way, I have a jacket and tie in the car, but she told me I didn't have to wear it, and that's good enough for me if Mrs. Maldonado says it. Her partnership and investment in the community is absolutely remarkable, to the point where she puts on an orange vest and directs traffic for our community events. Not because she has to, because it's what is right for the community, and she does whatever the community needs. It's about the partnership with the Hidalgo County Department of Health and Human Services. Eddie Olivares started this conversation 7 years ago. He made the early introductions. It's about the Health Resources Services Administration part of the partnership, HRSA. And I know we all have our concerns and complaints about the federal government, but this is one of those partnerships that works, right? They've invested. We wouldn't be having this conversation without the investment from HRSA. And we certainly wouldn't be having the partnership of UT RGV School of Medicine. Through their match, they match 1-to-1 from the federal investment, but also the investment of clinicians and educators to make this partnership happen. Because of those partnerships, we have this fantastic clinic. Again, it's a wonderful building that we're expanding, but it's not about the building. It's about the people who make it work. It's about the nurse practitioners, about the community health workers, about the LPNs, the staff. It's right here in front of us today that make it work, day in and day out. Because of these primary care clinics, there's 3 of them across the valley that's part of the AHEC program, we provided over 25,000 patient visits. Over 8,000 individuals have received primary health care. You know our community, these are folks that otherwise wouldn't get health care, right? Over 90% of them don't have insurance, no prior access to health care. It's about a partnership with the OBGYN department, right? Dr. Ogden, Dr. Ricos, who bring in the resources from their grants, Healthy Mujeres, Title 10, CPRIT, family planning. Over 2,000 women in our community have received specialized women health services since 2022. They wouldn't get it otherwise. It's about the partnership with the Texas State Department of Health Services through our Health Disparities Program. Through it, we encourage vaccinations, we promote vaccination, we promote diabetes prevention, and community resources at all different levels. Our team, many of them are here today, provide what we call comprehensive or wraparound services. So, as good as medicine is, it's not enough, right? A lot of our folks who get a diagnosis, they get great health care, they get a prescription, but they can't afford the prescription. Or they don't have transportation to go get the medicine or to get to the specialist. These folks help. It's about our partnership with the Health Resources Services Administration through the Behavioral Health Grant that allows us to provide behavioral health, treatment for depression and anxiety right here on site, in tandem, in cooperation with our medical providers. And it's about the UT Health RGV Unimobile, who reaches many, many more rural areas and supports our AHEC operation. And finally, but not totally by any means, but we forget the partnership with and the impact on education and training, right? Healthcare is important, but ultimately it's about changing things for the future. And we're doing that through the exposure of students like Hector Trejo, right? But over 250 AHEC scholars, students from medicine, nursing, physician assistants, social work, and other disciplines, have gone through our AHEC clinics, seeing rural medicine, the realities of rural medicine for the first time. Over 20 medical residents have learned in your AHEC, in your community. All of our first-year medical students come through our AHECs, and they also get shadowing and observation opportunities. We also involve high school students through pipeline programs. In our joint admission medical program, students who are admitted to medical school early have a chance to come through the AHECs. It's all about teamwork. Certainly the clinic is teamwork. Our community events are teamwork. Yesterday, our team was here putting the finishing touches on the clinic. They did that because they're a team. They support each other. So this event certainly is remarkable because of the building, and thank you again, Commissioner, and thanks to the county. But mostly it's remarkable because of the people and the partnership that got us here today. So thank you for allowing us to be part of it.
Thank you so much, Dr. Monroe. We have representation from Hidalgo County Precinct 4 Commissioner Eddie Cantu. We have Ms. Olivia Gomez and Ms. Erica Zamora. Thank you for joining us. And the AHEC roommates, we do have representation from the WIG Clinic with Ms. Gloria and her staff. Thank you so much for being here. Continuing on to our program, I want to introduce Mr. Rene Olivares, RO Engineering, for some project remarks for us this morning. Please join us, Mr. Olivares.
Good morning. I first want to thank Commissioner Eli Torres for allowing me to be part of her vision and trying to execute the vision she has for this complex. Behind the scenes, there's been a lot of work, a lot of discussions, and beyond what I've done, I know they've had to do a lot of negotiations with the land acquisition so that you can, and you can also have parking as well. And then the other challenge is making that dollar stretch, making sure that we get the most for our dollar. As you can see, this is a portable building that was already constructed in another location of the county, and Ellie was able to see what that would be good for, and I just came in and tried to assist and here for to try to help Ellie execute her vision. It all started when we started with the partnership with Valley Metro. Down at the south side by 107, we constructed a bus shelter that will allow you to come and access these areas safely. And so during that time, it was a small budget, but then eventually Ellie got to see the needs, and so we expanded with this project that was already mentioned that will be underway to expand the parking, to bring some lighting, digital marquee, etc. Make this place look a little bit, well, a lot better. And you'll be seeing that, but it started with the bus shelter, and now you can see the building here with plenty of offices so that you can service the community, especially the children. Ellie and I go back to the school district, and that's been her passion, the children, and I think, you know, that's what's going on here, and I'm really happy and proud to be part of it, because this is about helping the community, and I'm just, you know, providing a little bit of it, and I'm really happy for that. This building, talking about the building, this building is 1,400 square feet. It was a challenge to get it here. We have power and water that has its own dedicated meter so that building would be independent. There was a lot of delays to etc., but you know, we were able to manage to bring it in here, and there are some challenges still here that are going to be addressed, like the low-lying areas, the drain, etc., but that's going to be taken care of with the following project. And I'm very proud to be with Hidalgo County Precinct 4 with Ellie Torres and her group. Thank you very much.
Thank you so much, Mr. Olivares, being here with us this morning. And before we move on to the ribbon cutting portion of our ceremony, I'd just like to mention two things. Number one, as been previously mentioned, there will be great improvements in the parking lot area of this area. So we invite you to our groundbreaking celebration in a few short weeks. And the second thing I'd like to mention is as after our ceremony has been concluded, we invite everyone who is here today to please join us with tours of both the main AHEC facility, where there's beverages and all kinds of goodies, and also the actual Annex building itself, where you will see fully equipped patient rooms, a lobby, all that great items that are needed for a running of a clinic and the operations of a clinic that we're excited to show everybody. So now with that said, if everybody could please join us in this area where we will be cutting the ribbon. Anybody who came with us today, please join us. Miss Nilda right there has the ribbon and the scissors. And again, this is a celebration of the community, so we invite everybody to join us in our ribbon cutting here right in front of the Annex building. Go ahead and gather everybody behind the ribbon. So it's many close up. All right, we're going to take a few photos. We're going to take a few